It's Dr. Alicia here, and welcome to the She Found Motherhood podcast. Today we have a birth story, and let me tell you, this one is a bit of a complicated one. Melissa joins us, and she got pregnant with her son after 2 miscarriages, one of them needing an emergency D&C. Then she found out midway through her pregnancy that her cervix was really short and needed an emergency cerclage placed. She then went to 40 weeks of pregnancy and needed an induction to get into labor. What a journey. And all of this in a pandemic. Anyways, she did really well, as did her son. And part of the big difference was her attitude and her coping strategies throughout. So have a listen right after this. Now, if you want to learn more about pregnancy and delivery, join us on our prenatal course. We go through all of the last few weeks of pregnancy throughout the birthing experience, and we cover all things postpartum and newborn. It's one of the most comprehensive courses you can get, and it's the same price as many of our local courses, which barely delve into these topics. So if you're interested in join us, check it out under courses at www.shefoundhealth.ca. Welcome to the She Found Motherhood podcast, where our goal is to support you in the journey from pregnancy through to parenthood. We are so passionate about this time in a woman's life, and we want to make sure you have fun and reliable information you can trust. She Found Motherhood podcast is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This does not apply to every situation. If you have questions or if you have received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Hey, Melissa, welcome to the She Found Motherhood podcast. Today we are talking about your birth story. So I would love if you would let us know a little bit about yourself.
Well, it's taken a while for us to get where we are. We did have some infertility issues before we had our little guy. I was busy working, but things have changed now, so we'll just keep plugging along the way we are at the moment.
Great. Well, do you mind telling us a little bit about your kind of journey to getting pregnant?
We did have 2 miscarriages before we ended up having our little guy. The first one was at 6 weeks, and the second one was at 11 weeks, and I ended up having an emergency D&C, not even in my home province, so that was even more fun.
Yeah, that's a challenge. And miscarriage is unfortunately, such a common part of people's kind of journey through pregnancy. But that is, having to have a D&C and not even in your home place is a huge challenge, right? Without your supports around you and stuff. Yeah, I'm sorry to hear that. How was getting pregnant with your son? How did that go?
It was about 3 months after the miscarriage, so I don't know if having that D&C somehow helped us out in a weird way. But about 3 months after, found out we were pregnant and had some spotting and stuff. And it was around the same time that I had that miscarriage, so that threw my anxiety up a bit, just kind of worrying about that in previous. But everything was good. And then probably around 19 weeks is where it took a slight turn, but we ended up okay.
So tell me about that slight turn. What happened at that 19-week mark?
We went and had our anatomy scan, and everything was going good. And then the tech was like, your cervix is quite short. And she went and talked to, I guess, her upper person. And then he came in and entered the room, and we're like, okay, well, your doctor's on shift over at Victoria General, and because we were at a different hospital. And she's like, well, you're going to go see your doctor, and we're going to get you fixed up. And that was about all they told me at that point. So I was like, okay. So my husband and I finished up our anatomy scan and then go over to VicGen and then see our doctor.
And then what happened?
Well, she walked in and the first words out of her mouth were, well, shit. And we're like, okay.
That's never a good start to a conversation, is it?
No, it's not. But at the same point, it was oddly comforting in a way, because we're like, okay, well, obviously this isn't good, but hopefully we're catching it before anything else can kind of go awry. So then at that point, they did an exam and we're like, okay, nope, your cervix is wide open. And I was like, okay, well, that's not good. So unfortunately, they didn't tell me not to eat after my anatomy scan. So I had a little snack on the way over. So then we had to wait 8 hours before I could even go in for my surgery. But we waited the 8 hours, and then yeah, I got into surgery around, I think, 10 p.m. at night.
And you had what done? Just for people, because a lot of people have no idea what would happen next. Yeah.
At that point, I had a cerclage, so they stitched me up so that my baby couldn't escape at that point.
Yeah. So essentially, what a cerclage is putting a big suture, or sometimes it's almost like a thickish string, through your cervix and tying it shut so that it acts like our natural cervix should ideally act, to keep your baby inside of your uterus until it's time to come out, hopefully at term, right?
Mhm. Yeah.
So how did the cerclage feel afterwards? Was it uncomfortable? Did you notice it? Were there any kind of symptoms that you had from it?
No, actually, I was a little tender down there right after the surgery. Um, Thankfully, didn't really have much spotting or pain or anything. And then once, a couple days after, I had no pain. I couldn't even feel it for the remainder of my pregnancy.
Awesome. And then what did kind of monitoring look like for you in your pregnancy? So how did they keep an eyeball to make sure everything was going okay from the cerclage and the cervix point of view?
So after that, I had appointments every 2 weeks at the Child and Family Ambulatory Unit at the hospital, where they would check how long my cervix was. And then I was also having every 2 week visits with my doctor at your clinic there. So it was basically every week I had an appointment somewhere.
I know we do make you work really hard, hey, when you have those some of those complications of pregnancy,
Yep.
but keep an eyeball on baby. So how far did you get in pregnancy? Tell us about kind of the story leading up to delivery.
So made it to 37 weeks, came in, had a checkup. They're like, okay, well, baby's heart rate's a little high. Let's send you for a non-stress test. I'm like, okay, cool. We go to the hospital. My cerclage was planned to be taken out, I think, about 5 days after this. And go to the hospital. They're like, oh, well, you're having some contractions, which I didn't feel. I could feel my muscles tightening, but no pain. They're like, well, you're here. We'll take your cerclage out now. I'm like, okay. So they do that. That was beyond uncomfortable, but I made it through it. And when they took it out, I ended up being 3 centimeters dilated, and labor didn't start. So they're like, okay, go home, carry on your way. And then the next 3 weeks went by, and each week I gained another centimeter. So 40 weeks comes along, and I'm 6 centimeters dilated, but no sign of labor. And so I actually was watching a Facebook Live of a retirement of my old manager. And after that happens, I get a call from my doctor. They're like, well, you're 6 centimeters dilated. I don't want you to have this baby on the side of the road. So labor and delivery is slow. We're going to send you in and induce you. And I went,
Surprise.
okay. I'm like, I'm okay with that because it means everything's still going to be okay.
And you were probably very ready at that point, right?
You know what? It wasn't until about 39 weeks where I was kind of finally like, okay, I could actually deal with this baby being out. But I think I was just so happy to be pregnant because it was like, okay, let's get you to 28 weeks.
Mhm.
And then that happened in January. And I was like, okay, let's go for another week and another week. And just every week that he was inside, I was just so thankful for, because of course they give you all the different case scenarios before I went in for my cerclage surgery. So it's like, if he's born before this week, we don't do resuscitation. After this, we do, and all of that kind of stuff. So it was trying to make those little milestones. And I was like, okay, we've made another week. Let's continue on.
That's such a great attitude. And I think that's such a huge, and even just listening to you talk about, you had these complications and okay, we'll figure it out. I think that's such a great attitude. And unfortunately, for many of us, we don't naturally have that. And so it's a lot of kind
Mhm.
of work to get there and to kind of justify it in your brain. And I'm not saying that you weren't anxious about things or worried about things. I'm sure you were, but
Yeah.
just having that kind of like, okay, we'll just deal with what comes and move on. And if we get another week, great. Let's just kind of keep hitting those like small milestones, right? Until
Yeah.
we make it to, in your case, 40 weeks.
Hmm.
So they brought you into hospital at 40 weeks with a 6 centimeter dilated cervix. Then what
Hmm.
happened?
They were like, okay, well, do you want to do Pitocin or do you want to just break your water? And I went, whatever you think. In the end, they were like, well, let's break your water. And then if nothing happens, then we'll go with the Pitocin. I was like, okay, sounds good. So they broke my water. I did not appreciate feeling that, but it's also part of the journey at that point.
So when you say did not appreciate feeling that, do you mean the contractions that started afterwards, or was the actual breaking of the water uncomfortable for you?
It wasn't uncomfortable. I just didn't like all the liquid
Oh
coming
yeah,
out.
yeah. Fair enough.
So
It does have to come out of there, but yeah.
it
Okay. So
does.
the breaking of the waters was not uncomfortable because normally we don't
No.
expect it to be uncomfortable. But that feeling of all of that gushing fluid that you have no control over going all over the
Yeah.
place.
Yeah.
Gotcha.
That was the part I didn't like. Yeah, the breaking of the water was no problem at all. And then about 45 minutes later, contractions started. So yeah, I got into. They popped my water around 4. By about 4:45, 5 o'clock, started having contractions. I knew I wanted an epidural, so I was like, okay, yeah, let's work on that. So I think by about 7 o'clock, I had an epidural, and then by about I think it was 9 or 9:30, they're like, well, you're fully dilated. Do you have an urge to push? And I'm like, no. They're like, okay, well, we can hang out here. Let him make his way down a little more. I'm like, all right. So we did that for about another 45 minutes. And then I started pushing. And I was only pushing about 30 to 45 minutes, and he was out by 10:56.
Nice. And so did you guys do kind of delayed cord clamping? Was he up on your like did he do skin to skin with him right away? How were those first kind of few minutes to an hour for you?
It was good. He did end up right on my belly. We didn't ask for delayed cord clamping, so I'm assuming it was just kind of the typical. I think they waited a minute or so
Yeah, we
before
do
they did.
that for most. Yeah, that's what we consider delayed cord clamping. So falls well. Yeah.
Okay. Yeah, and then my husband cut the cord. I did have a tear. They said it was a typical first mom tear, but I was getting sutured up for almost an hour after. So that was not so fun, but again, part of the journey at that point.
Were you still nice and frozen from the epidural from that, or did they need to use a little bit more freezing?
They did do some localized shots just for
Okay.
because of where the epidural, I guess, couldn't reach.
Okay, fair
So
enough.
those shots were not so fun.
They're a little pinchy and burny, no doubt about
Yeah.
that. Yeah. And then how did things go kind of over the next few days? Did you guys choose to breastfeed or like how was that journey for you the next few days?
Good. We did do breastfeeding. He didn't get a great latch within the hospital. So we ended up staying in hospital for 3 days because he did have a bit of jaundice. And then we had to go do the bilirubin check the day after we got home. Um, and that was fine. It worked itself out. But he still wasn't having a great latch. I did proceed to try, and after 3 months, I finally hit my breaking point where I was in so much pain, I was in tears, and I was like, okay. And at that point, I decided to exclusively pump.
Yeah. And how did that go? How was kind of that process, that pumping process?
It was fine because they started me pumping in the hospital actually, when we weren't getting a great latch and whatnot. And I already did have a pump at home in anticipation of at least being able to have my husband help out with a feed here or there.
Right. So you were
Um,
already pumping through the challenges of the latching experience. You were kind of doing some
yeah,
pumping already. Okay.
yeah,
Um,
and he was on a mix of formula when we came home. And then by August, I was actually able to get him off formula altogether, and just on breast milk with my pumping.
Awesome. That's really great. What did you have any kind of tips or tricks in terms of pumping that you found really useful? Did you have like a specific setup, or is there anything that you kind of found that you kind of made it a little bit easier or more efficient or more effective for you?
It took me a while because initially I had a single pump. By the end, I do have a double pump now. And I have a proper like pumping bra, and having enough parts that you can do a couple pumping sessions without having to wash in between has definitely helped. Um, yeah, and just it was a little bit of me time, but at the same point not, because sometimes I'd have to work on, watching the little guy if I was doing that, or my husband couldn't because he was thankfully working from home at this point.
Yeah.
But yeah, having the parts, and yeah, it took me a while to figure out the double pump, but once I did, that was the biggest time saver.
Yeah. Did you notice any difference whether you had your son in front of you in terms of like milk supply or letdown as opposed to not? Like, was there any difference there? Some people notice a big difference and other people don't at all.
For me, there was no difference. It didn't
Yeah.
matter if he was there or in another room. It was
Same
the
kind of
same
production.
essentially. Yeah.
Awesome. Awesome. Cool. And over those, like for the first 3, 4 months, how did you do kind of like mood wise? How did you find that? How were you kind of doing? Because you were in the middle of the pandemic too, right?
Yeah.
Well, how did
It
you kind of
was
manage all that?
very hard because my parents are out in Alberta, and actually same with my husband's mom. And we had planned for my mom to come out here. So unfortunately, that didn't happen. So there were honestly a lot of tears that I wasn't necessarily prepared for. um, but my husband was kind of expecting it, funnily enough. Um, so it was hard, but at the same point, my husband and I, we made it work and we figured it out. It was struggling, especially like because I could see some other friends were helping out another coworker with meal trains and stuff, and they didn't necessarily think of my husband and I. So I was a little resentful towards that, going like that could have helped us for at least, a couple weeks or something. But again, my husband and I were pretty tough, so we just kind of worked our way through it. Yeah.
So is that something that you would kind of suggest to pregnant people now, is kind of thinking about what supports would be helpful postpartum and starting to kind of make those connections and ask for that help before you even have your baby? Or how would you, if you were to do it differently, I guess, how would you approach it? Knowing what you know now, how would you approach that differently?
I would try and yeah, arrange either a meal delivery service or having someone be able to bring something off, even if it's just dropping it at your doorstep. Of course, in this time with the pandemic. Um, and then yeah, like if you ever think, hey, you're struggling, you want some therapy, maybe prearrange some of those appointments and stuff, along with your normal doctor follow-ups. Um, Definitely good tips. Unfortunately, I couldn't even try and prep cook because of my cerclage. I was only allowed to stand for an hour a day and walk like 1 to 2 hours. So I was very limited because I ended up on medical leave after I had my cerclage. So I didn't really get to do much. I couldn't prep or anything like that for us before I had him.
How did you spend your time during that from your cerclage to that 37-week mark? I'm always curious how people pass the time because it's hard, right? You're
Yeah.
doing it for a good reason. You understand
hmm
that, but the actual like logistics of it, how did you what did you do? How did you spend your time?
Well, I am an avid crocheter. So I did do a lot of crocheting. We also happened to move about 3 weeks after my surgery. Thankfully, we had a moving company and I did not lift a thing. I did pack some boxes here or there, but from a sitting position. So I did help my husband unpack a little bit here or there. I would do one box, but then I'm like, no, I'm tired. I'm not pushing it. And again, I wasn't allowed to lift more than 10 to 15 pounds. So I was very cautious of that. Um, Anytime I was lifting or moving anything, just because I didn't want to risk that at that point.
Yeah, fair enough. What was your favorite part about pregnancy or the postpartum period? What is your fondest memory? What kind of stands out in your brain?
For me, I honestly loved watching him kick inside my stomach. I love looking back on those videos and seeing my stomach randomly move or feeling the kicks.
Nice. And what was the most challenging part for you?
The challenging part was not letting my anxiety get the better part of me, being that we'd had the miscarriages and stuff, and then we were dealing with this pretty serious complication of trying to keep him inside. um, but then we joke that we opened the door at 37 weeks and he still didn't want to come out. So, um, yeah, it was honestly just trying to keep my anxiety at bay.
And how did you do that? Do you have any kind of suggestions for people or anything that you found really useful?
Um, I had done some therapy and whatnot, especially after the second miscarriage. So I was kind of seeing her a little bit into the start of the pregnancy. I ended up not going after just because I was in a good place. Um, and I stopped going before we ended up having the cerclage. But um, just trying not to get into the circle of the negative thoughts and whatnot was a big help of being like, okay, no, I see that. Let me validate why I'm feeling this and carry on and not let it kind of suck me down.
Awesome. So you use some of those skills that you had learned within your therapy sessions during that time.
Yeah.
That's so great. Is there anything that you'd like to tell pregnant or newly postpartum or even trying to conceive people for advice? Anything that you think, if somebody had told me this, it would have been so helpful for me?
I don't know that there's anything. I want to just say enjoy the journey. Like I look back at it now and I miss being pregnant already. And I kind of wonder if I didn't enjoy my pregnancy as much because of my anxiety and maybe the complications that we were experiencing.
Right. So taking pleasure in the positive things that are happening
Yeah.
and recognizing those. Hey, awesome.
Yeah.
Very cool. Well, thank you so much for doing this with us today. I really appreciate it. And I'm so glad that everything, despite the complications and the challenges, and you had quite a few, that everything
Yeah.
worked out really well for you. Hey?
Yeah, it did. Thankfully.
Yeah.
Have our little rainbow baby.
So good. Hey? All right.
Yeah.
Well, have a lovely day, Melissa.
You as well.
If you enjoyed listening, please head over to iTunes, subscribe so you don't miss any new episodes, and please leave us a review. If you found this helpful, take a screenshot and share on social to help other mamas access this information.
Check out our website at www.shefoundhealth.ca and join our community. We send out weekly emails and release new content focused on this incredible time in your lives. We'll also be sharing exclusive offers, so be sure not to miss out.